On April 29, 1961, at the edge of the world, a 27-year-old Soviet surgeon lay on a narrow cot inside a frozen shelter. Outside, a blizzard roared across the ice, sealing 12 men off from the rest of humanity for the next 6 months. Inside, Dr. Leonid Rogozov was dying. A sharp, unbearable agony flared in his lower right abdomen. His fever was spiking. His heart was racing. As a trained physician, he didn't need a second opinion to know what was happening. His appendix was inflamed, infected, and hours away from bursting. There was no rescue plane coming through the storm, no hospital within thousands of miles, and the worst of all, he was the only doctor on the entire continent of Antarctica. To survive the night, he was going to have to do something no surgeon had ever attempted. He was going to have to cut into his own body, navigate through his own abdominal wall, and slice out the infected organ with his own hands. To understand how Leonid found himself in this waking nightmare, we have to go back 6 months earlier. In late 1960, the 6th Soviet Antarctic Expedition set sail. Among them was Leonid Rogozov, a brilliant, quiet, promising young doctor who put his residency on hold to join the polar journey. By February 1961, the team had constructed a station on the desolate coast of Queen Maud Land. By April, the polar night set in. The sea froze over, turning the station into an isolated island, surrounded by thousands of miles of impossible ice. The weather made aviation completely impossible. And that's when the sickness struck. At first, it was just a dull ache near his stomach. Leonid tries to convince himself it was a simple indigestion. But by the next morning, the pain had migrated to the lower right quadrant, the classic sign. He wrote in his diary, "I kept quiet about it, even smiled. Why frighten my friends? They couldn't help anyway." He tried everything. He lay completely still. He placed ice packs on his abdomen to slow the inflammation. He took heavy doses of antibiotics. But by evening, the pain was radiating through his entire torso, and his temperature skyrocketed. He knew the pathology. If that appendix ruptured, infected pus would flood his abdominal cavity. Peritonitis would set in. Death would follow within 24 to 48 hours. Painful, toxic, and absolute. Leonid had only 2 options left: either surrender to the infection or perform an operation on himself. He called his team together, a crew made up of meteorologists, mechanical engineers, and a station driver. They were tough men, used to surviving harsh polar winters. But when Leonid explained his plan, their faces turned pale. He wasn't just asking them to watch. He needed them to act as his surgical assistants. Leonid assigned rules with strict precision. The station director stood by as the safety officer, ready to step in if anyone fainted. A mechanical engineer was assigned to hold a small table mirror so Leonid could see inside the incision. A meteorologist was given a desk lamp to shine light directly into his opened abdomen. Leonid briefed them with stark, terrifying honesty. "If I lose consciousness," he told them, "you will inject me with this syringe. If I point to something, hand me the tool. Do not panic." He sanitized the room, sterilized the scalpel, clamp, and scissors, and set up a tilted bed so he could sit at a semi-reclined angle. He couldn't use general anesthesia. It would knock him out instantly. He had to settle for a local anesthetic called Novocaine, injecting it into his own abdominal wall. The Novocaine would numb his skin, but it would do nothing for the deep pain inside his internal organs. He would feel every tear, every tug, and every cut. At 2 a.m. on April 30th, the surgery began. Leonid pulled on his rubber gloves. He reached down to his right side, took a breath, and pressed the scalpel into his own skin. The first cut was 12 centimeters long. Almost immediately, the plan to use the mirror backfired. Because the mirror inverted the image, everything was backward. His hands moved left when he needed to go right. It was confusing his brain and slowing him down. So Leonid made a wild, agonizing decision. He threw the mirror aside. He took off his surgical gloves. From that point on, he would perform the operation entirely by feel. He reached his bare fingers directly into his own abdominal wall, pushing past layers of muscle and tissue, groping blind for the infected organ. The agony was overwhelming. Sweat poured down his forehead, blurring his vision. Every few minutes, his head began to spin from blood loss and shock. He had to pause, take deep, ragged breaths, and rest his head on the pillow for 20 seconds before pushing back up to continue. His assistants were terrified. The meteorologists holding the lamp began shaking so violently from horror that the light bounced wildly around the room. The engineer holding the spare instruments almost lost consciousness. Then, disaster struck. While cutting through the deeper muscle layer, Leonid's hand slipped. The scalpel nicked a major blood vessel, as well as his cecum, part of his large intestine. Blood filled the incision cavity, blinding his touch. Leonid stopped. He took a breath, stitched the intestine wound, clamped the blood vessel, and scooped the pooled blood out of his own abdomen. Finally, after 45 agonizing minutes, his fingers wrapped around it. The appendix. It was dark, swollen, and on the verge of tearing open. With icy focus, Leonid clamped the base of the appendix, tied it off, and severed it with the scalpel. He washed out the open cavity with antibiotics, injected his abdominal wall with direct anti-infection medication, and began the slow, tedious process of stitching his own muscle and skin back together. By the time the final knot was tied, 1 hour and 45 minutes had passed. Leonid cleaned his tools, instructed his shaking assistants on how to clean the room, took a dose of sleeping pills, and finally closed his eyes. 2 days later, his fever broke. Within a week, the stitches came out. Within 2 weeks, the 27-year-old doctor was back on his feet, taking weather readings and doing his rounds around the station as if nothing extraordinary had ever happened. When the expedition returned home in 1962, Leonid Rogozov was hailed as a national hero in the Soviet Union. He was awarded the Order of the Red Banner of Labor, an honor typically reserved for heroic soldiers or top scientists. Yet, for the rest of his life, Leonid rejected the idea that he was a hero. When reporters asked him about that harrowing night in Antarctica, he would simply smile, wave his hand, and say, "A job like any other, a life like any other." He went on to live a quiet life as a professor and surgeon in Leningrad, passing away in the year 2000. Today, Leonid's self-appendectomy remains one of the most astonishing examples of human resilience, psychological composure, and sheer survival willpower ever recorded in the medical history. He looked death in the eye, took a scalpel in his hand, and proved that when there is no one left to save you, you save yourself.